the Heimlich type assist. So consider this the patient, this is the head of the patient, the upper chest and lower chest. So this will be the xiphoid process of the patient. This will be the xiphoid process, and this is the epigastric region. Okay. Now what we do is, with the manipulating hand, the heel of the hand will be placed just inferior to the xiphoid process here like this, and a force is applied inwards and upwards in this direction like this. So the process will be like this. Ask the patient to inhale, the patient inhales, ask to hold the breath, and then ask the patient to cough. As the patient coughs, we give a upward and inward push with the manipulating hand like